Now, let's start by describing the third, the fourth, and the sixth cranial nerves. That is the oculomotor, the trochlear, and the abducent nerves. What will follow for these three nerves is to describe the functions and the deep origin. So starting by the oculomotor functions are general somatic efferent and general visceral efferent. That is the function of this nerve. The deep origin or the nuclear origin, the motor nucleus of the oculomotor, the parasympathetic nucleus, the Edengerostval nucleus. Here you are. This is the motor nucleus of the third nerve, and this is the Edengerostval nucleus. Both of them are present in the upper part of the midbrain. When it comes to the trochlear nerve, the fourth nerve, it is general somatic efferent only, and the deep origin is from the motor nucleus of the trochlear nerve, which is this one here at the lower part of the midbrain, just below the inferior colliculus. As you can see, each fibers of each nerve cross to the other side. The crossing is very clear in this diagram here. It comes from one side to another to continue its course. The last one, the abducent, the sixth nerve, again is pure motor nucleus of the abducent nerve in the deep origin, and it is present in the bones, as you can see here. Its nucleus gives the fibers which curve around the nucleus of the facial nerve here in the floor of the fourth ventricle, forming the immentia medialis or the facial colliculus, which is formed by the facial nerve fibers and the nucleus of the abducent. That is the function, the deep origin of the three nerves. Now, for the superficial origin, here, the oculomotor from the interpeduncular fossa of the midbrain, just above the cerebral peduncle, from this side and that side here. The trochlear nerve will be from the back of the midbrain to curve around the side of the cerebral peduncle, reaching the front from here and here. And the abducent nerve, the sixth nerve here, is arising from the pontomedullary angle above the pyramid. And these are the three superficial origin of the three nerves. We'd consider this one as the figure number one. Then the relation of the oculomotor, trochlear, and abducent nerves in relation to the dura mater. You know, each cranial nerve has to pierce the bia, the arachnoid, and the dura at a special part or at a definite situation in relation to the dura mater. What we can see here, this is the representing the clavus of the skull, the dura mater on the clavus, and this is the tentorium cerebelli, the free border and the attached border, the free border reaching the anterior clinoid process, while the attached will reach the posterior clinoid process. So that is the dura and the clavus, that is the free border, and that is the attached border of the tentorium. This is the oculomotor piercing the bia, the arachnoid, and the dura just in front of point of the causation of the free with the attached border. The trochlear nerve exactly at the point of the causation between the free and the attached border. Behind them and still below in the posterior cranial fossa, the trigeminal nerve will be behind that point of the causation, while the abducent nerve will be piercing the dura, which lies on the clavus of the skull. That is the relation of the dura mater to the nerves, and this will consider it number two. When it comes to, we are continuing now with the course of these nerves. In the course, the relation of these nerves within the cavernous sinus, you can see there is an intimate relation between the three nerves they are going in the same direction with the same relation to the parts of the brain and the intracranial structures. So this is the relation in relation to the cavernous sinus. In the lateral wall, in the top, the oculomotor, followed by the trochlear, then the ophthalmic, then the maxillary nerve embedded in the lateral wall. Within the cavity, we'll find the intercarotid artery, and just lateral to it will be the abducent nerve. That is number 3 figure. Now they leave the cavernous sinus to enter the orbit through the superior orbital fissure. That is the diagram of superior orbital fissure, where they are arranged either outside the tendinous ring, this is the tendinous ring, giving origin to the four recti, the medial, the lateral by two heads, the superior and the inferior recti. This is the optic nerve and the ophthalmic artery. The most lateral one is the lacrimal, outside the ring, then followed by the frontal, and lastly the trochlear outside. Inside will be the superior division of the oculomotor, then the nasociliary nerve, and then the inferior division of oculomotor. So between the two divisions will be the nasociliary, and lastly the abducent in the most lateral part. That's the relations in the superior optic fissure. This is the optic nerve with the ophthalmic artery, as we said, and this will carry number 4. In number 5 here, this is a coronal section in the orbit. The three nerves will be finalized in the orbital cavity. This is a coronal section where show the position of the structures within the orbital cavity. On the most lateral side, the lacrimal gland, then the superior oblique on the superior posterior in the medial upper angle of the medial border or medial side, then the superior rectus, above it the levator palpebrae superioris superiorly, then the medial rectus on the medial side, the inferior oblique, above it the inferior rectus, and most laterally will be the lateral rectus. This is the arrangement of the structures of inside the orbit, where the nerves will be in relation to them. So that's number 5A, you can say. And then the second one, the nerves in relation to these structures. We have the lacrimal nerve, which is very close to the lacrimal gland, the abducent nerve, which is very close to the abductor muscle, the lateral rectus, the superior division of oculomotor, and the inferior division of oculomotor, one above and one below the optic nerve, and then the frontal nerve just directly below the roof, above the levator palpebrae superioris, the optic nerve in the middle, then the nasociliary lying between the superior oblique and the superior rectus along the medial wall of the orbit after it crosses the optic nerve. And this is the trochlear nerve, which supplies the medial, the superior oblique, the nerve, the muscle which have a tendon curving around the trochlear. So that is the trochlear nerve supplying that muscle. That's number 5B. If we summarize the course, will be coming from superficial origin as number 1, different parts of the brain stem, the bones and the midbrain. Then going to, in relation to the tentorium cerebelli, the free border, the attached border, and the clavus. Then going to enter the cavernous sinus, some of them in the lateral wall, the oculomotor, trochlear, and the ophthalmic with the maxillary, and in the cavity, the abducent just lateral to the internal carotid. Then it will go to the superior orbital fissure, some of them outside the ring, and some of them inside the ring between the two heads of the lateral rectus. And lastly, they end in the cavity of the orbit in relation to the structures we have mentioned. So about the oculomotor, the function, as we said, general somatic efferent and general visceral efferent. The deep origin by motor nucleus of the oculomotor, and the Edinger-Westerval nucleus, both of them found in the midbrain. Superficial origin from the interpeduncular fossa of the midbrain, that is the interpeduncular fossa. The course and relation, which is important to remember, arise from the interpeduncular fossa of the midbrain on the medial side of the cerebral peduncle. This is the cerebral peduncle over here. Between two arteries, which are the superior cerebellar artery, that is the one, and the posterior cerebral artery. You can see the nerve between both of them, between the posterior, the cerebral, and the superior cerebellar arteries, and the nerve can be entrapped between these two arteries. So it's an important part of its course between the posterior cerebral, this one here, and the superior cerebellar artery. It pierces the bia, the arachnoid, as we said, pierces the dura in front of the bond of decussation between the free and attached borders of the tentorium cerebelli in figure 2, the last one, and then pass within the lateral wall of the cavernous sinus just above the trochlear nerve. That's number 3 in the course. It leaves the sinus, divides into two divisions, superior and inferior. Both of them will enter the cavity through the orbital cavity through the suborbital fissure between the two heads of the lateral rectus within the common tendinous ring, having the necessary in between both of them. This have been shown in figure 4. Within the orbit or orbital cavity, it gives branches, superior division, but above the optic and end in sublying superior rectus, levator palpebris superioris, inferior division, which will supply the inferior rectus, the medial rectus, the inferior oblique, and will give a branch to the ciliary ganglion, which is the parasympathetic branch to ciliary muscles and pupillary muscles. That is the oculomotor. The trochlear nerve, the number 4 nerve, which can be seen here curving from the back just on the side of the cerebral peduncle. Its function is only motor, general somatic efferent. Deep origin, one nucleus taking the name of the nerve, motor nucleus trochlear. Superficial origin from the back of the midbrain, below the inferior colliculus, on the sides of what we call it frenulum villi. Because the nerve will curve around the lateral side of the cerebral peduncle between the posterior cerebral and the superior cerebellar, like that of the oculomotor, pierces the bia, arachnoid, and dura exactly at the joint, at the point of decussation between the free and the attached border of the tentorium. Then it will continue passing in the lateral wall of the cavernous sinus, below the oculomotor above the ophthalmic, enter the orbital cavity through the suborbital fissure, outside the ring, medial to the frontal nerve. In the orbit, it passes medially to enter the orbital surface of the superior oblique muscle, which it supplies. About the abducent nerve, the sixth nerve, the functions again pure sensory. The deep origin, one nucleus, motor nucleus of abducent. Superficial origin from the pontomedullary angle above the pyramid, that is the pyramid here. So it lies above the pyramid. About its course, it will pierce the bia, the arachnoid, and the dura at the clavus of the skull. That is the pontomedullary angle here. So it then enters the floor of the cavernous sinus, lying lateral to the internal carotid artery within the cavity. It enters the orbit through the medial end of the superior orbital fissure within the common tendinous ring to end by supplying the lateral rectus. Thank you.